I'm a receptionist at a public hospital in Amsterdam, and last Saturday, this American couple rushed through our emergency entrance. The wife holding her husband's arm while he clutched his side. She kept repeating, "How much is this going to cost?" Before anyone even asked what happened. My colleague handed them the standard intake form while explained we'd see him immediately since the waiting room only had 2 other families. The wife interrupted me mid-sentence, voice shaking, asking if we accepted payment plans because they only had $8,000 available on their credit cards. I stared at her, confused, then told her the visit would probably run about €200 total. She went completely silent, looked at her husband, then back at me and said, "That's it?" For the whole thing? I nodded. Her husband had appendicitis. Got surgery that same day, stayed 2 nights, and their final bill came to €1,100. She cried when she saw it, told me in America the same procedure would have cost them $40,000 minimum, even with insurance. My cousin works at a pharmacy in Prague, and a few weeks back, an American college student came in with antibiotics prescribed at our walk-in clinic. She asked how much her copay would be. He scanned it, told her €6. She laughed, said, "No, I mean my portion after insurance." He repeated, €6, that's the full price. She pulled out her phone and showed him a screenshot of the same antibiotic from back home, priced at $370. My brother manages a private cardiology clinic in Munich, and last month an American businessman showed up for a consultation his company doctor recommended. After the exam and EKG, the cardiologist explained he'd need a stress test and maybe a follow-up scan. The American immediately asked, "Which tests does my insurance approve?" The doctor looked confused, said, "The ones you medically need," and started writing referrals.
Yes.
The patient stopped him, insisting they call his insurance company in Boston first to verify coverage. The doctor refused, explaining that in Germany, doctors decide treatment based on medical necessity, not insurance company approval. The American got agitated, pulled out his insurance card, demanded to speak to someone who understood how American coverage works internationally. My brother had to sit him down and explain that the clinic doesn't call insurance companies for permission. You just treat patients and send bills later. The guy couldn't wrap his head around it. He kept saying, "But what if they deny the claim?" My brother finally told him the scan costs €400 total. Just pay it. And the American stared at him like he'd quoted 40,000. I'm a medical student doing rotations in Lisbon, and we had an American woman come into our public hospital with severe stomach pain. The attending physician examined her, ordered blood work and an ultrasound, then admitted her for observation. She kept asking every nurse who came by when someone would talk to her about costs and payment. After 6 hours, she flagged me down in the hallway, frantic, saying nobody had discussed her bill yet, and she needed to know if she should leave before it got out of control. I brought her to the billing office where they explained she'd owe maybe €200 maximum for everything. She started crying, told us she'd been lying in that bed calculating how much debt she'd go into, assuming each test added thousands to her total. The billing clerk apologized for not explaining sooner, not realizing Americans arrive at hospitals expecting financial catastrophe. My father is a surgeon in Warsaw, and he once had an American patient who needed a minor procedure to remove a cyst. During the pre-op consultation, the patient asked what would happen if complications arose during surgery. My father explained they'd handle any complications as needed. The American clarified, asking specifically about the cost if the procedure went longer than expected. My father told him there's no additional cost. The surgery is the surgery. The patient pressed harder, insisting there must be extra charges for unexpected complications or extended operating time. Pulling out his phone to show my father itemized bills from American hospitals where every 15-minute increment added $1,500. My father laughed, thought he was joking. The American wasn't joking. He'd brought a list of approved complications his insurance would cover versus ones they'd deny. My father told him, "I don't talk to insurance companies. I talk to the tumor. And if it takes 20 minutes or 2 hours, you pay the same." The American made my father put that in writing. I work at a university health center in Stockholm, and an American exchange student came in complaining about persistent headaches. The doctor ordered an MRI, told her to schedule it for next week. She asked how much it would cost. He said about 200 kronor, maybe $30. She left, then came back 10 minutes later, asking if she'd misheard because an MRI in America costs $3,000 minimum. The doctor confirmed the price, and she started arguing with him, saying there's no way an MRI only costs $30. He pulled up the billing code on his computer, showed her the standard rate. She sat down, put her head in her hands, and said, "I've been putting off this MRI for 8 months because I thought I'd graduate with an extra $10,000 in medical debt." She got the scan 3 days later and told everyone in her dorm they were scamming Americans back home. I'm a pharmacy technician in Vienna. And last summer, an American woman came in with a prescription for insulin her doctor in Paris had written during her vacation there. She handed it to the pharmacist, already pulling out her wallet, asking if we could run it through her American insurance. The pharmacist scanned it, told her €70 for a 3-month supply. She froze, asked him to repeat that. He said it again, €70 total. She told him, "That's impossible. She pays $450 per month back home, even with insurance." The pharmacist shrugged, explained that Austria negotiates drug prices with manufacturers. She bought 6 months' worth, on the spot. Then asked if she could have that in writing because she didn't think her friends would believe her. The pharmacist printed a receipt, and she took a photo of it next to the pharmacy sign. "My uncle works in emergency services in Brussels. And a few years ago, an American tourist came in after slipping on wet cobblestones and gashing his forehead. The nurse cleaned the wound, said he'd need 5 stitches. The American asked how much each stitch cost. The nurse laughed, thinking it was a cultural joke, but he was serious. He'd literally been calculating in his head, assuming each stitch would run $500 based on his experience in Florida. The nurse told him the entire visit would cost about €80, accused her of lying, demanded to see an itemized estimate before they touched him. The doctor came out, annoyed, and told him they don't itemize by stitch, they treat wounds, and he can either get stitched up or leave with a bandage. The American reluctantly agreed, got his stitches, and when he paid at the desk afterward, he asked the clerk 3 separate times if this was the real total or if a bigger bill would arrive later. The clerk promised him that's it, no surprise bills. I'm a general practitioner in Dublin, and an American family came to my clinic because their daughter had an ear infection. After examining her, I wrote a prescription for antibiotics and scheduled a follow-up for next week. So the father asked what the visit cost. I told him €60. He nodded, then asked about the follow-up. I said another €60 if needed. He pulled out a calculator on his phone and started adding numbers. His wife asked me how much the prescription would cost. I said maybe €15 at the pharmacy. The father stopped calculating, looked at me, said, "So, we're talking about €135 total for 2 doctor visits and medication." I confirmed that, and he told me back home this same situation cost them $800 after insurance. Their insurance company fought them on covering the follow-up because they claimed ear infections resolve naturally within 10 days, so the second visit was medically unnecessary. He asked if I could write a detailed note explaining why the follow-up was important so he could show his insurance company. But I had to tell him I don't write letters to insurance companies, because they're not involved in treatment decisions here. My sister is a nurse in Oslo, and she once treated an American tourist who developed a nasty infection and a cut on his hand. He needed for antibiotics and observation. While she was setting up his IV, he asked if he should call his insurance company to get pre-authorization. She asked what pre-authorization meant. He explained that in America, you have to call your insurance before getting treatment to make sure they agree it's necessary. Otherwise, they won't pay. She told him that sounds insane. Just sit back and relax. He called anyway, spent 20 minutes on hold with some representative in Texas who kept asking for billing codes and facility numbers. The representative told him they don't cover international care except emergencies, and they'd need to review his case to determine if IV antibiotics qualified. He hung up, visibly stressed, and my sister told him it doesn't matter what his insurance says. We're treating the infection regardless, and his bill would be around €300 total. He said that's less than his insurance copay would have been at home. I worked the ticket counter at a rail station in Rotterdam, and this American couple approached me asking for directions to the nearest in-network urgent care facility, because the husband had sliced his thumb opening a can. I didn't understand what a network meant, so I just directed them to the hospital 3 blocks away. The wife asked if it was in network with Blue Cross Blue Shield. I explained that in the Netherlands, all hospitals treat everyone. There's no network. She insisted there must be a network, pulled up her insurance app. TRIED showing me a map of approved facilities in the United States. I kept telling her it doesn't work that way here, just go to the hospital. She asked if going to an out-of-network hospital would cost them more. I finally gave up explaining. Told them the hospital would charge maybe €150 for stitches, and they could argue with their insurance later. My cousin is a paramedic in Athens, and he responded to a call where an American tourist had fallen off a moped and broken his collarbone. In the ambulance, the guy kept asking my cousin how much the ambulance ride cost per mile. My cousin told him it's free. The American said, "No. I mean, how much does your company charge per mile?" My cousin repeated, "It's free. There's no charge." The American got agitated, said everything cost something, demanded to know the rate. My cousin finally told him, "In Greece, ambulances are a public service like roads. You don't pay per mile?" The American muttered something about socialist medicine and pulled out his phone to calculate what the ride would have cost in Arizona. At the hospital, he refused pain medication until someone gave him a price list. The doctor told him the pain meds were included in his care. The American didn't believe him, said American hospitals charge $30 per ibuprofen tablet. The doctor asked if he wanted the medication or wanted to keep complaining. I'm a translator at a hospital in Krakow. An American woman hired me to help her communicate with doctors after she was admitted with a severe allergic reaction. During her stay, she asked me to find out when the billing department would visit her room to discuss payment options. I explained they don't do that here. You just pay when you're discharged. She insisted she needed to set up a payment plan before the bill got too high. I kept telling her the bill won't be high, maybe €800 for 2 days, including all medications and tests. She told me that's impossible. She'd been hospitalized in Ohio for 1 day last year, and it cost $22,000. I showed her the standard pricing sheet the hospital publishes online. She spent an hour reading it, convinced there were hidden fees. When she was discharged 3 days later and her bill came to €940, she asked the clerk if this was a deposit or the full amount. The clerk confirmed it was the full amount. The woman just stood there, then asked if she could donate money to the hospital, because she felt guilty paying so little. My neighbor works at a clinic in Zurich. An American tech worker living there temporarily came in for a routine physical. At the end, the doctor told him everything looked good, and he could pick up his blood work results next week. The American asked how much he owed. The doctor said about 300 francs. The American paused, then asked if that included the blood work. The doctor said yes. The American asked if it included the doctor's time. The doctor said yes, that's what the visit costs. The American pulled out his phone, showed the doctor a bill from his last physical in San Francisco that cost $2,800 after insurance. The doctor looked at it, genuinely shocked, asked what all these line items were. The American explained, "That's the facility fee. That's the doctor fee. That's the lab fee. That's the processing fee. That's the administrative fee." The doctor told him none of those things exist as separate charges in Switzerland. You just pay for the visit. The American asked, "So what if I need 3 blood tests instead of 2? Does the price change?" The doctor said no, the visit is the visit. I'm back at my hospital reception desk in Amsterdam. And 2 weeks after that appendicitis case, the same American couple returned. Not for treatment, just to give our surgical team a box of chocolates and thank you cards. The wife told me they'd called their insurance company back in Texas to file a claim for the €1,100. The insurance rep laughed at them, said the bill was so low it didn't meet their deductible, so they wouldn't reimburse anything. She said the rep actually told her, "Next time, get sick in America where we can properly bill for services." Oh, they were stunned. The husband told me they'd started researching healthcare costs in other countries and realized they'd been paying 8 times more their entire lives for objectively worse access to care. They asked if we were hiring Americans. I told them we are. They'd have to accept that working here means their own healthcare would cost almost nothing. They'd have to find something else to stress about. She said that sounded perfect.